Hi friends, welcome to Physiodemic. Today I will tell you about the cervical spinal stenosis. So cervical spinal stenosis is the narrowing of the spinal canal, which results in compressions of the spinal cord and spinal nerve root, which affects the functions of the spinal cord and nerve. And it's occurred due to the cervical spondylosis, traumatic, inflammatory conditions, and herniated discs and tumor. So now I will tell you about the pathophysiology. So the compressions of the spinal cord leads to the compressions of the local vascular structure, which leads to the ischemia of the spinal cord. And the compressions due to the repeated local trauma to the spinal cord and root due to the repetitive flexions and extensions movement, and it affects morely C5, C6 and C6, C7 level. Now I'll tell you about the etiology. So the first, congenital narrowing is exacerbated by the pathophysiological factors and disc herniation with osteophytic spores, hypertrophy of the articular fascial ligamentum flavums, ossification of posterior longitudinal ligament, then subluxation due to the facets joint degeneration. So now I will tell you about the clinical features. So symptoms are due to the cervical radiculopathy and cervical myelopathy. More than 30% of the narrowing leads to the gait disturbance, lower limb weaknesses, ataxias. So radicular symptoms is due to the nerve root compressions, which depends upon the level affected. Okay, and the pain of the necks, arm, and frequent falling, bladder and bowel incontinence. Now I'll tell you about the differential diagnosis. So the differential diagnosis are ankylosing spondylitis, Paget's disease, peripheral neuropathy, spinal cord tumor, vertebral disc diseases, and vascular insufficiency. Now then I will go to the diagnosis procedures of the cervical stenosis. So basically, these X-ray, CT scans, and MRI is required to diagnose these conditions. And the CT scans differentiates the calcified discs and bone osteophytes, and also detect the ossifications of the PLL and lytic lesion, any bony fractures or lytic lesion. MRI is a gold standard procedures for this diagnosis of the cervical spinal stenosis, as it's able to show the intrinsic cause abnormality and the degree of spinal stenosis, and also it differentiates the other conditions like spinal tumors, hematoma, infections. So now I'll tell you about the medical management. So initially both the conservative and non-surgical methods are included, and these are the physiotherapy, epidural steroid injections, and analgesic medications. So surgical treatment is considered with other conservative when the other conservative measures fails, and the surgical treatment aim to improve the symptoms, and treatment methods are decompression, laminectomy with spinal fusion. Now I will tell you about the physical therapy management. And the aim of physical therapy management to reduce the pain and increase the patient function. So program may include the stretching exercises to restore the flexibility of the muscles, then manual therapy to improve the joint range of motions and maintain the range of motions, heat therapy to improve the blood circulation to the muscles and soft tissues, then cardiovascular endurance exercises to promote the physical conditioning, aquatic exercises to do with out pressures on the spines, strengthening exercises of the upper limb and lower extremities muscles, then postural re-educations, then scapular stabilizations exercises, and ergonomic advice and frequent change of positioning. Now I'll tell you about the prognosis. So this is the conditions has significant morbidity which affects the quality of the lives, and leads to the chronic pains and muscle weaknesses. And some patients shows gait abnormality also, and some patients improve with time, and majority have progressions of the condition leading to disability. So thanks for watching and stay tuned to these channels for further update.